Hi, this video is the art of hair transplant restoration surgery on an African American. It's actually Djiboutian. I guess the border between Ethiopian and Somalian somewhere. So Eastern African American men. Our hairline for African American and Asians is around from the mid eyebrow to the hairline is around 6.5 to 7 centimeter. The midpoint from the midpoint to the side around 7 to 9 centimeter, but his is actually in a quarter. If you look at it, if we don't bring his temple, his forehead, it's gonna be too wide, and then he just have a low hairline and looks too wide. All ethnic, the temple, bring it in is very important for African American men. Because it really framed the face better. And then once we get the shape down, I'm very precise when I do the hairline drawing, because you want to make sure both sides are even, and make sure when you bring in the temple is even as well. We have for black, the zigzag is smaller in amplitude. Why? Most black men like to line up the hairline anyway. For Asian and Caucasian, we have a bigger amplitude because the way we really don't line our hair up. And then the other important factor is the angle of the hair. We transplant at a 15 degree coming out. It's more flat. And in most black men, if you shave the hair kind of hug against the skin, and that's how it should be. But when it's long, it curl and it's fine. And the precise angle is important because we want to follow that. So then when you have the wave and all stuff, you can comb it and then follow that natural pattern. And we like to continue with that. For Asian and Caucasian, you start on 35, 45 in the front, increases when you go backward, and changes when you go different direction. Not only the precise angle is important, the selection of hair grafts is important. We try and plant rows and rows single hair graft in the front, followed by root of 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The goal in the front is for softness and naturalness. You don't want no detectability. The goal in the back for volume and density, and that's important. When it comes to hairline design, I will be personally designing the hairline. You cannot leave it to technician design the hairline because they could really ruin your look. With me, not just designing the hairline is important, but harvesting the hair graft, I do that, and then suturing up or do FUE where I pull one head of graft at a time. I will be personally doing that. It takes time, but it will give you the best result. And then making hole is important, and I will be doing that. The only thing my technician does is they place the hair graft in at the angle that I created. So this is the art of hair transplant restoration surgery on a client with a class 4 hair loss pattern. Thank you.